And I suppose what I would sort of urge people is there's so much, isn't there, on Facebook, social media, saying for help and care. What the thing is, if you're worrying, if you're starting to think about all these really expensive supplements that you feel something isn't right in yourself, still please use primary care. That's your first point of call. It's not that £200 collagen cortisol supplement. So again, if you are feeling that there is something either with your cycles, with your mood, your mental health, your periods that are really starting to impact your life, if it's starting to worry you, again, we're learning more about the perimenopause, menopause, but if things are changing, you feel there is a hormonal imbalance in which you're starting to struggle or it's impacting your day-to-day functioning, please come and speak with us. We don't need to wait for the hot flushes to start. We don't need to wait for the night sweats. We don't need to wait for the periods to necessarily change. But please, if there are issues and it is impacting you, your well-being, your day-to-day life, like that's the time your GP wants to speak with you. There are options available. That's where the digital triage comes in. I know I mentioned to you, Amit, the worry is that might put women off, raising, we're sort of, it looks like we're iMessaging what our women's health issue is, and that can feel embarrassing. I know I'm a patient, I'm a woman, it can feel a bit unusual to put on there, I have these issues, you don't know who's reading it. It can feel quite personal or sensitive, but please know that is being looked by a clinician, and actually these are issues we want to see, whether that is painful sex, a low libido, periods that are painful, periods that are really heavy. This is still really important medical information that actually there are possibly things that we can do. So although practices, we're now urged kind of by government to be using digital triage tools, that's still the forum to do it, and that is okay.